I wondered if we could just talk through some of the work that you've been doing and the book that you've recently written, the Triple Aim. And this morning when I heard your keynote address, you were talking about patient engagement. So are there 3 or 4 key messages which you think the world could embrace about patient engagement? They're really key, important messages that you would want to get across to an audience if you had 2 minutes, not 20.
I'd say one key message is that patients and families bring incredible strength and assets to every conversation. Even when a patient is in the difficult position of hearing bad news, the way that the healthcare conversation can go with that patient can bring power to the patient so that they're not in the difficult position of being dictated to or ordered about. And I think the old ways we used to think clearly need to change to bring about that kind of conversation.
Mm-hmm. And what do you think the level of maturity is of the patient to understand that they might actually have that power to engage with the system?
It's a great question, and what I see is varying levels of maturity. My mother, as an example, when she would go to her physician, she would basically say to him, "Whatever you recommend is what I'll do." And she was a healthcare professional herself, but she was in a position of feeling and finding great comfort in his recommendations. Me, I'm very different. I'll go and sit and have a conversation with my physician about my real wants and needs, whether I'm really going to take this medication she prescribes or not, what symptoms I'm having as a result. And my son is very different entirely. I think the millennials go to Dr. Google first and then go to their physician with a lot of recommendations and questions. And I think we've got to be flexible in meeting each patient where they're at.
Yes, it's interesting. My mother, who died last year at 90, was a great one for Googling things about it. So it's amazing because when people have a sense that they have that power and give themselves permission to engage with that.